at the meeting are members of the Cabinet and a number of council officers, and if they come into the debates they will say who they are. Before we proceed, can I remind all attendees to turn their mobile phones to silence? There's nothing worse than hearing ringtones across an online meeting. Can I also refer members and officers to the published protocols for holding virtual meetings, and noting the following in particular. Members of the Cabinet should ensure they have their videos on at all times, but can you put microphones on mute and less speaking, because then it stops the reverb that comes through. Other members and participants should switch off their videos and put microphones on mute until they're invited to speak. If someone wishes to speak, could you please indicate by the raised hand function within Teams, and I will call people in one at a time. In case of a technical problem, a meeting will adjourn until the issue is resolved. If the technical problem persists and the meeting is inchoate, the meeting will be adjourned and rearranged for a later date. If it is just me having a technical problem, then the chair of the meeting will be taken over by Councillor Keith Ferry as deputy leader. And touch wood, to date we haven't had those problems, so we don't want tonight to be the first. And the meeting is being audio and video recorded and will be available to watch, listen to on the council website. Is that okay? Right, so before we get into item 1, apologies of absence, I just think we need to say that the country is going through some very difficult times, and today the government announced that the number of deaths linked to COVID-19 is now over 50,000. Since our last Cabinet meeting, we have moved from Tier 2 into a national lockdown, which has added significant pressures to the services provided by the council that were already overloaded. Residents and businesses are quite rightly concerned and anxious about the situation in Harrow. So with Cabinet's agreement, I propose that the agenda order be slightly varied, and that item 8, which is the COVID-19 update, be moved up the agenda and heard after the declarations of interest items. Is that agreed? Yep, thank you. So for apologies of absence, I haven't received any apologies of absence. Declarations of interest, they have been published on the council website, and I note that Councillor Sue Anderson has declared a non-pecuniary interest at item 15. Can I have any declarations from other members present in the virtual meeting, please? No hands have gone up, so I assume there isn't any. If any member becomes aware of an interest during the meeting, please raise your virtual hand and you can declare it then. It makes it easier. This now moves us on to the COVID-19 update. I would like to invite Sean Harris, Chief Executive, Harrow Council, to present the update. And can you please note that the presentation will be available online. So over to you, Sean.
Thank you very much, Councillor Henson. Andre is just going to put the presentation up and hand over control to me, so I will start very shortly when he's done that.
Excellent.
So yes, thank you very much, Councillor Henson. Thank you, Cabinet members and members of the Council and public who are watching the Cabinet meeting this evening. As Councillor Henson has mentioned, a very significant amount of activity and change has taken place since our last Cabinet meeting, and as at the previous Cabinet meeting, the intention is to provide a presentation and verbal update about the key developments in relation to COVID-19 and the Council's response to that. Partly because of the very rapidly moving situation, it is very difficult to write a report which captures all the position as we go along. So the presentation tonight will cover a number of key issues. We will provide an update on the position of COVID-19 in London and in Harrow. We will talk about the impact of the tier system and London being in tier 2 prior to lockdown, and then the implications of us moving into a national lockdown from the earlier part of this month. Then spend some time talking about the Council's response to COVID in a number of different ways, including our work on COVID-related activity and the broader impact on the council's services. I'm also going to cover briefly what we know at the moment and the implications of the council's work to support the preparation for the potential rollout of a vaccine. And there's also a significant amount of information relating to both the council's financial context and the resources that have been made available to the council from the government in order to be able to support local people, local businesses and the organisation. Just before I move into the presentation proper, Chair, I just wanted to start with offering my heartfelt thanks to all of the staff working in the council. It has been a very difficult and challenging 8 months for everyone concerned, as I know it has for council members, the community and local businesses. But I have been nothing but impressed again over the past 4 weeks about the amount of effort across the organisation, both to continue the delivery of our many hundreds of different services, but in particular the work that's been undertaken, often at very short notice, to respond to both the changing landscape in relation to COVID and also in terms of responding to the many initiatives that the council needs to be involved in. So I did just want to put that on the record, Chair, as Chief Executive, to thank the staff at all levels and also the support we've received across many organisations in Harrow. So just in terms of the position in relation to COVID, clearly people will be aware of the situation as it has developed nationally. There's been a significant increase in the number of cases overall, and that has clearly led to a number of changes in government policy relating to tackling the virus. Apologies. And obviously what we've also seen as well is, unfortunately and sadly, an increase in the number of hospital admissions across the country, and also a steady and significant increase in the number of people who are unfortunately passing away as a result of coronavirus. The position nationally is that there are currently around 250 cases per 100,000 people, which obviously masks significant variations across the country. The London position, while significant, is slightly below the national position of around 150 cases per 100,000 people, and actually Harrow's position is actually on that more or less on that average, where we have 150 cases per 100,000 people, which is significantly greater than it was just a few weeks ago. But over the last week to 10 days, we have seen a stabilisation in the position. You will also be aware as well that in London, hospital admissions are increasing, but this is not particularly rapid or at this stage particularly alarming in terms of the pressure that it's putting on the NHS in North West London. However, this is something that's being kept under review because many of the increases in the cases that we've seen over the past 2 or 3 weeks have yet to translate into impact on the NHS. Myself and Councillor Henson take part in a weekly call with all leaders and chief executives across London. And at the meeting on Monday, it was reported that there is some early signs that case levels are slowly stabilising in London and that the rate of increase is slowing down. And that appears to be partly related, at least, to the fact that London was in a set of tier 2 restrictions in advance of the local lockdown. So while it's too early to say whether that or the lockdown will make a significant difference, it is at this stage an encouraging sign. I think it's also important as well, Chair and members of the Cabinet, that we continue to reinforce the messages of hands, face, space, and that people should comply with all of the different aspects of the regulations, both in Harrow and generally, in order to continue to suppress the spread of the virus. The next slide, which has been expertly prepared by my colleagues in Harrow's Public Health Department, provides an overall summary dashboard of the COVID-19 situation in Harrow. It covers, for example, the incident rates in terms of how many cases there have been over the past 7 days. It highlights also importantly, because this is one of the areas of concern, that there is a rise in the number of cases of people aged 60 and over. A week ago, that was quite a bit lower than that. It was around the 60 level, and it's now risen over 100. And it is clearly the increase in the more vulnerable population which is driving some of the concern in terms of the overall position in relation to COVID, but also the potential knock-on in terms of hospitalisations. And you will also see as well the work that's been undertaken in terms of test, track and trace, the overall testing rate and the positivity rate, which indicates that if there was more testing, given that the positivity rate is in the red, that actually we would probably be uncovering a greater number of cases in the borough. But overall, the trend does remain upwards, although the rate of change is slowing and the doubling rate is extending over a period of time. I think the greatest concern, as I said, was the spread of the number of cases in residents over 60. So hopefully that will be a helpful oversight for members and the public of what the situation is in Harrow. So just in terms of the council's response, which is both a strategic response and an operational one. The first thing to say is that the council continues to play a very major role in responding to COVID-19. It is the main focus of our strategic capacity that is included at political level and at managerial level, and it underpins the work of almost all council officers in some way, shape or form, whether or not they are delivering services out in the community on the front line, whether they're delivering targeted services in areas such as social care, or whether or not they are supporting the overall delivery of the council's work as part of a more office-based environment. It's also true to say as well that and much of this is positive, although challenging in terms of capacity, the council continues to be given almost on a weekly basis an increase in the number of COVID-19 specific tasks, clearly around things such as testing, track and trace, business grants, rollout of asymptomatic, etc. There is an increasing number of elements that the council is being asked to support the national effort in responding to coronavirus, and we are on almost a daily basis being requested to take on additional responsibilities and take forward initiatives which is all about helping supporting the local community and tackling coronavirus. Secondly, the council has to continue to deliver many hundreds of different services, obviously impacted on by potential staff absence through COVID and also self-isolation, but similarly many of our services are being delivered in completely different ways, whether that's be a mixture of new ways of dealing things with very significant numbers of staff working at home, whether it's providing virtual support in areas such as children's social care, and also providing services to vulnerable adults in a completely different way. So there's been a very big change in the terms of how we run our services, with the vast majority of staff working at home, but also in the way in which we deliver those services. And similarly, we continue to work hard to deliver as many of our strategic projects as we can, but clearly the capacity challenge and the resilience challenge of the organisation is one that we have to be very mindful of, given the fact we are 8 months into probably the biggest test that the world and the country has had since the wars of the last century, but also in a situation whereby we expect this situation to last at least until the spring, and the challenge that we will face will probably increase during that period. But I think overall, I'm pleased to say that despite a number of creaks and shakes, overall we are managing to continue to deliver our services to a reasonable standard to local people in a very difficult set of circumstances, and also deliver many of the additional tasks that we've been asked to do to respond to the pandemic. This slide, Cabinet, is a summary of what existed before the most recent national lockdown. As you know, the government introduced a tiered system. There is a huge amount of detail under each of the tiers in terms of the rules and regulations, but the high level summaries, particularly what impacts most directly in the public, is summarised in each of these tiers. And prior to lockdown, London was in tier 2, which had a whole series of limitations related to it. And we expect that when and if, as is planned, the national lockdown is lifted in early December, a decision will need to be made about which tier of restrictions London and Harrow moves into. I would hope that if the continued slowing down of the increase in cases and the success of the lockdown, etc., in terms of suppressing the R number continues, that we should be hopeful that the most likely outcome for London would be, in the first instance, a return to tier 2 restrictions rather than there being an increase. But clearly, what will happen will very much depend on the progression of the virus in the city over the next 3 weeks until early December. The national lockdown, which came into force on the 5th of November, there are a summary of key changes that took place from then, which exists until the 2nd of December, which clearly is increasing the very clear message about staying at home, widespread closures of non-essential retail, hospitality, etc., including a number of council services, and also an impact into civil society in terms of people being able to meet, community centres, places of worship. And similarly, although shielding has not been formally reintroduced, there has been a communication with all of the 14,000 people who are clinically extremely vulnerable in Harrow, in order to be able to provide them with updated advice about their welfare and their activity to reduce their risk of transmission of the disease. And the council is working with our partners in the voluntary sector and with health in order to make sure that all of those people are communicated with and also provided with the help, support and advice that they may need if they're not able to find this from their own family or friends. So a significant change over the past week, which took a very large amount of preparation and planning for across the organisation, both in terms of our own services, but also in terms of providing support and advice to many local businesses and communities. This is a very high level summary, Cabinet, but this is just an example of a number of the COVID-19 specific tasks that the council has been working on since the last cabinet meeting and continues to do so. We have started the rollout of local track and trace, where this means that where people aren't able to be contacted by the National Track and Trace Service, the council is on the phones and seeking to identify people to advise them to self-isolate in order to support the reduction in the spread of the virus. We have established a local testing site, and we're also in the process of seeking to establish 2 further local testing sites in order that local people can get a test. There's been a huge amount of activity from the enforcement team, ensuring that all of our businesses, hospitality venues, and all of the other parts of the infrastructure in the organisation that has to change as a result of both initially the tier 2 restrictions, but then also the lockdown measures are done so. I think it's fair to say that overall we have been very pleased with the cooperation we have received from businesses across the borough and also the broad compliance of local people. However, that's not to say that there haven't been examples of poor practice or businesses that we haven't had to advise or seek to change what they're doing in what is a complex set of circumstances and arrangements. But overall, I think we should say that we are pleased with the outcome of how both public and business compliance has gone so far in relation to lockdown. The council is helping to support the provision of self-isolation benefits. And as I'll mention later on in the presentation, we have been given additional funding for a whole range of grants to local businesses who have been impacted initially from the tier 2 changes and then subsequently by lockdown. And that will be a very significant task for the council over the next few weeks to both work out the support that will be given to local businesses and to make sure those payments are made, which is all part of our broader work to support the local economy. And we have been working extensively with local businesses, traders associations and the Harrow Town Centre BID on that work. And also, as I've previously mentioned, significant amount of support through the community hub and the council's contact centre, responding to local people's needs, and also working with the voluntary sector to make sure that people who are in disadvantage are given the support that they need as a result of their vulnerability to COVID. Similarly, as I mentioned earlier, there is a broader and wider service impact on the council as a result of responding to COVID-19, whether that's delivering services in a new and innovative way, whether it's ensuring that we can deliver services to people with the vast majority of our 2,000 staff working at home. We are now very effective in terms of being able to do that where we had little capacity at the beginning of the pandemic. Significant pressures on our services to vulnerable people, the number of children needing specialist support, the number of looked after children, the number of families in crisis has significantly increased. And obviously, as a result of the nature of the pandemic, the pressure on our adult social care is one of the most extreme examples of our ability to respond to the virus. And working closely with our colleagues in the NHS, we will be ensuring that we continue to provide that support over the winter, which is always a particularly challenging period for adult social care, working around tackling issues relating to homelessness and housing pressures. A very significant amount of work with the borough's over 100 schools. And I have to say, it's an opportunity as well to pay tribute to the work of head teachers, staff, teachers, governors, etc., who have worked across the family of schools in Harrow very effectively to make sure that as part of this lockdown, all of the schools and educational establishments have stayed open, which is incredibly important, both to help support the education of our young people, but also to support the ongoing ability of their parents and carers to contribute to the local economy. Other examples including ensuring our waste services are resilient and also thinking ahead to preparing for the GLA and mayoral elections in May next year. This is not a comprehensive list, Cabinet, of all of the work that's been going on. That would be a very considerable task, but it is a series of examples of the different and challenging issues that the council are having to respond to in terms of delivering services in a new and innovative way. I also very briefly, without being in a position to be able to share a huge amount of information at this stage, perhaps conclude this part of the presentation with something that is potentially somewhat more positive. Members of the Cabinet, members of the public will see that the Prime Minister and the Chief Medical Officer have updated the public this week, given the fact that there appears to be very encouraging signs from at least one of the vaccines that is currently in development. Whilst we won't find out until the end of this month whether or not that has proven to be beyond the regulatory position, whether or not that vaccine can actually be rolled out. But given the fact that clearly having a vaccine to help support tackling coronavirus is so important, the government has asked the NHS, supported by local government, to be in a position to start the rollout of the vaccine from the beginning of December, initially through December, targeted to the very vulnerable, whether they be in care settings or at home. And then from January, if this goes to plan, the ability to roll out over the next few months a vaccine to a much broader portion of the population, which will be incredibly important in stopping the spread of coronavirus and enabling us to return to some form of normality. Council has a key role in supporting the potential logistics of that delivery, ensuring that there is the availability of places where people can be vaccinated, etc., etc. And also we will have a very important role in communicating along with our NHS public health and community leaders the importance of and the availability of how people will get access to the vaccine. And I hope, Cabinet, that at the next meeting of the Cabinet in December, be in a position to provide a much more detailed explanation of the work that will go on, and hopefully the fact that we do have a vaccine to roll out over the next few months. And clearly this will be a very significant additional piece of work that the Council will be involved in, but clearly this is something that, if it happens in the way which is hoped, will be incredibly helpful. Just one thing to add to this slide, Chair. It is really important that even if we do have a successful vaccine rollout from the beginning of December, that does not mean all of the other things that people ought to be doing in terms of hands, face, space, in terms of social distancing, complying with the regulations, will be incredibly important. The vaccine will be very significant game changer over the medium term, but in the very short term we will need to continue to comply with the existing rules and regulations. Just something briefly in terms of the financial context facing the Council. This will be covered in much more detail at the December Cabinet meeting, when the Director of Finance and the Cabinet member brings the Council's draft budget. But clearly, as we know, COVID has significantly impacted on Council finances, and we have this year had to date around £17 million of emergency funding from the government, reflecting the additional costs that the Council has faced as a result of coronavirus, and also significant reductions in income. It is vital, as we will highlight in the Cabinet report in December, that this level of support continues for financial year 2021-22 to ensure the ongoing financial viability of the Council and our services. In the next few slides, Chair, I will very briefly highlight the fact that there have been numerous government grants that have been given to the Council for a range of specific purposes, in addition to the emergency funding to help us deliver a range of initiatives to support tackling COVID. And the Cabinet will be asked to agree specifically this evening some expenditure to bolster capacity in key areas. Chair, it's not my intention to go through the next few slides in a huge amount of detail, but it is important that they are there for the public record. This slide highlights a further tranche of emergency funding that the Council received, taking our total funding to just over £17.5 million, and also highlighted that we received a specific grant of just over £750,000 when we entered Tier 2. The next slide highlights a series of other grants that the Council has received. Council has received a further £5 per head from the government to support a whole range of initiatives such as track and trace, wider measures to protect public health, and supporting the local economy, and that has resulted in an additional £1.3 million. Council received just over £160,000 to support the clinically extremely vulnerable during lockdown, and we've also received around £600,000 to support vulnerable local people, including the ability to provide free meals for children with free school meals during the holidays from a new government fund that was announced over the weekend. Also, the Council has been given a series of funds in order to be able to support local business. Prior to the lockdown, because we were in Tier 2, we have been given just under £300,000 to support around 400 businesses in the hospitality, hotel and leisure industry, which were obviously going to be impacted as a result of the restrictions in social mixing that existed in Tier 2. And subsequent to the second lockdown announcement, the Council has been given further funding to support businesses that have had to close for the lockdown period, businesses that are partly had to close during the period, and we've been given just over £3.5 million in order to support a number of local businesses in that regard. It is worth saying at this point that the council allocated around £40 million in emergency grants to local businesses in the first lockdown. So clearly, whilst very welcome, these funds will only stretch so far. And also the council has been allocated just over £5 million on the basis of £20 per head for a discretionary grant to support the local economy both in this year and next. And as I mentioned in the overview financial slide, Chair, the council is having to spend further additional funding to address both challenges that we are facing within individual services and also in terms of the ability to support the delivery of many of the COVID related activities that I highlighted above. You can see that a number of them come with specific grants, and we are obviously in the process of using those grants to support that activity. But there are a series of other areas where we are finding specific challenges that there are no specific grants for, so we're using a proportion of the general resource that we've been given. And you can see on the slide that there are a series of allocations ranging from additional social work to help deliver the capacity around children's social care, some support to help our adult brokerage service, to do further community engagement, economic development, and also to respond to our capacity challenges around strategic coordination and HR. So one of the things we'll be asking as part of this item, Chair, is for the Cabinet to formally approve that fund and that expenditure. And it's also worth mentioning, although there is no specific request at this meeting, that there are a series of other areas which are highlighted on this slide, ranging from public health to support to the voluntary and community sector past March if the pandemic continues there, also to support additional work in the contact centre and in a number of other areas, including potentially enforcement. So this, at this point, this is for noting, but it's worth highlighting this is a number of areas where we expect that we will need to provide further capacity over the next few months. I'm conscious that that's been quite a lengthy presentation, Chair, and I have tried to cover a fair amount of ground in as much detail as I felt I was able to in the time allowed. I think that it's fair to say that this has been an unprecedented period for the council. That unprecedented period has increased significantly over the last 3 to 4 weeks, sorry, as we've gone into the second wave and as we've gone from tier 2 into lockdown. So as the summary slide says, COVID-19 continues to dominate all aspects of the council's activity across all our services and all our capacity. Much of that is around direct work to support the response to COVID-19, and much is to respond specifically to service pressures. Strong priority to support local communities and businesses through a very difficult period, and we will use the resources we've been given as best as we can to do that. I think as I'd just like to finish, Chair, really where I started by saying I think that overall the council and in particular our staff have responded very well to a very challenging set of circumstances, and I have confidence that we will continue to do so as we see ourselves through the second wave and hopefully into a position where things are more positive in the spring and summer next year. But obviously one of our big focus over the next few months is putting a lot of work into planning to maintain the capacity and retain organisational resilience in order to be able to see us through what is going to be a particularly challenging period. So thank you, Chair. Thank you, Cabinet. I hope that was a useful update.
Thank you very much, Sean. I see Paul Osborne has his hand up, but before he does, I'd just like to make a couple of quick comments myself. Sean has said that we do have regular briefings around COVID, not just locally, but also across West London and also across London, a weekly briefing around COVID. And it was using that evidence base that we supported the move to tier 2. And the figures now are showing that that sort of brought down the rapid rise of the COVID infections, particularly in Harrow, although they're still high. And just on funding, we've always been a low funded council, so it's quite a challenge of making sure that we can get through this crisis with a cash flow that's coming through. And so we pay credit to Dawn and her team for the amount of work they've put in to make sure we can account for all this money. But I will point out that we are still quite a bit short from the government bailout funds as it stands, and that will be detailed in the Cabinet report in December. And finally, I'd like to echo Sean's point around staff and also around the voluntary and community sector. The pressure on services, I think, has been relentless, and the teams are under a lot of pressure. But we've also, the voluntary sector has been as well. I went to visit the community kitchen the other week, and they were serving, distributing food to about 4,500 families. Although it's lower than the peak of the pandemic, it's still high and shows the level of need that's still required in Harrow, and they're gearing up. And to give some sort of depth to that, it's between 8 and 12 tonnes a day of food that is being distributed, and that is a lot of work. That's just one example of the work that's taking place. But as I say, I'd like to thank, I've been humbled actually by the response from staff. This pandemic for us has been going on since February. It's been, I always say, use the word that it's been relentless, because there has been no break and people are working 7 days a week and extended hours when they shouldn't do really. And that's why we need to bring in that added HR support that Sean has mentioned earlier on. But I think finally, we have got through this by working collectively across all partnerships and all people who want to get involved. And I think we can get through this stage as well. So I do have two hands up. Paul first and then John Higgins. Paul.
Thank you very much, Leader. Just for those members of the public watching, my name is Councillor Paul Osborne. I'm the leader of the Conservative group and I'm not a member of the Cabinet, but I'm speaking as the leader of the opposition. Clearly, I'd like to join with Graham and the Chief Executive in thanking the staff for all the work that they've done. And I think clearly it's been amazing that the effort that they've put in, and I think they need to be congratulated for it. And we all know that there are more challenges ahead and there's more work ahead. And our thoughts are with them on that, especially those on the front line who are coming in day out and doing and delivering these services. I do have a number of points, but I'm actually just going to make a very brief point because I know there's a huge number of members of the public who are waiting to ask questions. But my worry in this is we are still doing non-essential, non-urgent projects. We are trying to create capacity, but we are not stopping doing things that could create that capacity. I noticed in the list of allocations, you're talking about £120,000 for HR capacity and employee support, but at the same time, the council is spending £100,000 on the Black Lives Matters project, which I think could be pushed back into next year, and we could concentrate on the COVID crisis at the moment, which is both essential and urgent. I would also suggest that spending an extra £40,000 on community engagement is all well and good, but then the community engagement department need to look at what else they're doing, particularly around conferences and webinars that they're organising that are not related to COVID. But I think more fundamentally, the council could free up quite a lot of capacity and quite a lot of officer and member time by simply accepting some of the mistakes they made earlier on in this process and removing the low traffic neighbourhoods and removing the temporary strategic cycle lanes. The amount of time that's being spent by officers having to review this month in, month out, the amount of distress this is causing residents, it could all be resolved by the council following what other boroughs have done across London and recognising these schemes were put in without consultation, without local support, and to just take them away.
Sean, did you want to pick up the finance side and I'll pick up the other 2 points that Paul has made?
I mean, I think that clearly there is a difficult and challenging balancing act that the council has in relation to both delivering all it needs to do in relation to COVID and also in terms of services and strategic projects. And of course, there will always be different views both within the political leadership and opposition of the organisation and also within the managerial leadership about the appropriate judgments that are made in terms of what we can and can't continue to do in relation to all of the projects and programmes that we're trying to run. I think what we are seeking to do is to try and strike the right balance, both in terms of continuing with very important work, much of which is highlighted on today's agenda in terms of issues such as the Borough Plan, Black Lives Matter and other issues. But we obviously keep everything under review, and we are conscious that we will have to make decisions on an ongoing basis about where the capacity is, and where we can, we will continue to support delivery as much as possible on an ongoing basis.
Thank you, Sean. With regards to the other points that you've made, Paul, it is around an issue around priorities, about what people believe is necessary and what is factual to get us through the crisis, but also to maintain some sensibility of the council as a whole of what it's trying to do and protect people. There's been a whole range of reports that have been published that have said that has shone a spotlight on people from a black background who've been totally adversely affected by the COVID pandemic more than others, mainly because of dealing with poverty and also through health inequalities that are present within the borough. I understand the priority is to get through COVID through as an organisation, but it's also that we have to reach out and support those other members of the community that also need our help and support. Otherwise, you can't just put things on the back burner and hope they're sort of left and be gone about. And with low traffic neighbourhoods, it's interesting that people try distance. Actually, I can understand it why they're trying to distance themselves from government decisions. But this has been debated twice now at task traffic meetings. It has been consulted on in accordance with the emergency legislation that was set out. It was the way the schemes are consulted upon is during the 6 months of operation. And that is quite clearly set out in the guidance and the instruction that came with it, and also the funding is removed if we don't comply with those sort of that criteria. But as I say, that has been discussed at TARSAT meetings. We have our recommendations of how to move on with that, and they are being continually reviewed. Some of that will be answered to save time, some of that will be answered within some of the questions that are on the agenda tonight. John, you had your hand up.
Yeah, thank you, Leader. And thanks to Chief Exec for that very comprehensive explanation of where we are at the moment in terms of the council's response to COVID. I just want to add just a small amount to that. I know we've got quite a tight agenda in terms of the voluntary sector. I mean, I think one of the things that's been one of the positive features of the response locally is that of the local community, and how many local people looking after people in their local area, faith groups and mutual aid groups have risen to the challenge of supporting people alongside voluntary sector organisations. As the presentation from Chief Exec outlined, voluntary sector organisations have also experienced this increase in demand, which continues and is likely to continue for many months going forward, whatever happens on the vaccine front. Likewise, it has put tremendous pressure on organisations in terms of needing to support staff in terms of burnout, support staff in terms of having less staff around because of people needing to isolate and what have you, and indeed, as the council did in the early days, needing to change services over to an online offer. So those sort of pressures that have happened within the council and for council staff are very much happening in the voluntary sector, but across obviously a lot more organisations which are much smaller. So there's definitely an issue about sustainability and the pressures on those organisations. And I suppose in terms of the third sort of key area, like has been outlined already in terms of the council, there is considerable financial pressures which will undoubtedly have some impact on some organisations in terms of their longer term sustainability. And the extent to which some services can continue. Having said that, I mean, the short-term funding that's been put out there has been very helpful, and it was helpful to also see in Chief Exec's presentation that the need for some of that to continue into the April and beyond, given that the demand and the pressures aren't going to just evaporate at the end of the financial year. So I just wanted to add that in terms of context of the wider impact on the sector alongside the impact that's been outlined in terms of the council.
Thank you, John. Sean, did you want to add anything? Oh, sorry, we've got John's hand. Did you want to add anything or respond to some of the comments that John has made there?
I think that they were all very helpful and sensible observations and comments, which I think reflect the experience that we've had with working with the voluntary sector in the borough. I think the response has been very good. The partnership has developed very well. We are conscious that many of the pressures that I identified that have impacted on the council are similar with the voluntary sector, and we hope that through the funding and support that we have, and I'm sure will continue to give the voluntary sector, we'll at least be able to provide that level of support and help, which will continue the good partnership delivery that we have in relation to COVID.
Thank you, Sean. and that's an observation, John. I think we have a very mature relationship with the voluntary sector that has been built on through this pandemic, and I think it's that relationship that's allowed us to get through a lot of what how we dealt with a lot of the issues that have arisen. I don't see any other hands present, so we'll move to the recommendations. So can Cabinet note the Chief Executive's verbal update, which will be published online, endorse the initial allocation of funding for Harrow's COVID-19 response, which is set out in the presentation, and note that that the leader will consider and improve Harrow's scheme for distributing the additional restrictions grant, which is the flexible one that we have, as quickly as possible in accordance with agreed processes set by the council. Are they all agreed?
Agreed.
Agreed.
Thank you. So that now moves on to new item number 4, which is petitions. All petitioners have 1 minute to read out the terms of the petition. Are there any petitions from Cabinet members? I don't see any from Cabinet. So are there any petitions from councillors present in the virtual meeting? I've been advised that Marilyn has indicated she wishes to present a petition. Marilyn's got your hand up. Marilyn?
Thank you, Leader. This is a petition on behalf of the residents in Hilltop Way in Stanmore Park Ward. It's a petition for additional double yellow lines for Hilltop Way. Hilltop Way, Stanmore, is a small residential cul-de-sac. Frequently, vehicles are parked on both sides of the road, which regularly obstructs the passage of larger vehicles such as food delivery vehicles and waste collection lorries, and would and should the occasional rise prevent the passage of emergency vehicles such as fire engines and ambulances. We undersigned, and there are 27 people that have signed this, residents of Hilltop Way, Stanmore and surrounding properties, request the immediate introduction of additional double yellow lines outside numbers 11 and 12 as shown on the attached map, and I think a copy of this has been sent to the council, but they asked me to read it out as well, to allow residents safe access and exit from their properties and to prevent inappropriate parking which obstructs, hinders and prevents the accessibility of public service and emergency vehicles to all properties. Thank you, Leader.
Thank you, Marilyn. You said that's already been sent through.
It has been, but they asked me if I would present it, and I said I would. Thank you.
Thank you. That be presented through to the environment team. I've been advised that 3 members of the public have notified the council that they would like to present a petition tonight. That's 3 separate petitions. So the first person we have is Prash Kotecha, has indicated that they wish to present a petition on the removal of the low traffic roadblocks in Harrow on behalf of Free Harrow team. Are you there?
I am indeed. I hope you can hear me nice and clearly.
Yeah, if you'd like to read the petition out. Oh, we can see you as well.
Good, well, that's unfortunate, but that's just fine. So, respected leader, council members, cabinet members, officers, and of course, respected members of the public and Free Harrow team who are also with us. The petition we're looking to present, and I'll do it as concisely as I can, is the petition that is looking to remove the roadblocks in LTN 02, 03, 04, and 06. The purpose of this petition is to object to the road blockages that were put in obviously under COVID-19 as part of the LTN. The main issues that are already being experienced, as has been seen in the past month, and upon which this petition is based, which is now being signed by a collective of over 5,500 signatures, is firstly, the smooth flow of traffic is being seriously disrupted as major roads are being blocked, obviously, from one end or another. Obviously, it's resulted in excessive traffic and journey times, forcing probably a lot of traffic down narrow and quieter roads. Pollution has risen and the air quality has worsened, leading to further road and it will continue to worsen. Essential services, but especially emergency services, have experienced some delays, which of course could potentially prove fatal. Disabled, vulnerable, and less mobile residents are unintentionally being discriminated against. Many local businesses are being negatively impacted due to the reduced custom as well, of course. Major cyclist routes are being abandoned or underused due to heavy traffic and increased local pollution. No perceived increase in either footfall or cyclists, as kind of was anticipated. Home deliveries have become kind of difficult, especially affecting the immobile and elderly and vulnerable who need those home deliveries. Quieter roads have sadly led to some personal safety concerns when walking on roads, especially after dark. And some large residential and commercial developments, which you'll all be familiar with, such as Eastman Village and Harrow View West, are being undertaken, which is perceived to going to increase the pressure on the main roads, thus increasing pollution, congestions, and even heavier gridlocking. And lastly, while giving advantage to cyclists, the scheme has inadequately addressed the concerns of those who cannot or do not want to use cycles for personal, lifestyle, or cultural reasons. So the premise is that all the key issues that I've just read out above are being experienced currently when both car and pedestrian roads use is obviously considerably lower due to the current pandemic and COVID-19 circumstances. Therefore, we believe that contrary to the often cited traffic evaporation hypothesis, many of these issues are likely to worsen post-lockdown when normal traffic and pedestrian levels return. And I'll bring this to a close with the final parts of the petition. I'll brush past Grant Shapps' quote, of course, schemes that are rushed in or hastily rushed in where the benefits are not clearly visible or outweighed. We know the statement he made on the 18th of October. I won't paraphrase it. Harrow's consultation standard states that where a consultation doesn't meet the standards, it will not be allowed to launch. Sadly, therefore, well intended as it was, we believe the whole problem stems from a failure to adequately consider or consult. So whilst it's widely appreciated about the need to consider lower traffic, less pollution, safer cycling networks, it's clearly not this currently is clearly not the best way to do it. Other alternatives such as 20-mile-per-hour speed zone, one-way streets, staggered blocks, etc., could all be more widely acceptable and arguably less disruptive. Therefore, in conclusion, for now, this petition's premise is that the schemes need to be removed and the issues addressed from a starting point where, of course, the full democratic process is undertaken with adequate and fair consultation and consideration of all residents and groups, as is evident, obviously, by the 5,000 signatures of this petition currently, and on top of that, the 1,300 plus overwhelmingly negative comments on the council's own Street Space Trials website. Thank you for listening.
Thank you, Presh. That'll be referred to the environment team that deals with the traffic schemes themselves. We don't debate here at this meeting here, you're just presenting it, and there is no debate on petitions on the scheme. If there is more than 2,000 signatures on the petition of people living in Harrow, then there may be a 10-minute debate at the next full council meeting, but the Democratic Services team will be in touch if that's necessary.
Can I just add, Graham, I have a non-pecuniary interest that, given I think LTN 04 was mentioned, I live in that that LTN. So thank you.
Yes. Thank you, Paul. Thank you, Prash. We now move on to the second petition, which is Dr. Sarangi Mendes has indicated they wish to present a petition on the LTN 06 scheme. Are you there, Dr. Sarangi?
Hi, yes, good evening. Good evening, thanks very much. Good evening, Leader, councillors, officers and members of the public. We, the residents of Manor Way and Priory Way in North Harrow, object to the council's low traffic neighbourhood 06 scheme, which is closed Southfield Park. In a petition actively shared only with the residents of these two roads, 334 Harrow residents were against it. Whilst we support the overall objective of improving the environment, it is quite clear to us that this scheme is not working. The traffic has not evaporated, it has been displaced onto our two much smaller roads. We will continue to submit some photographic and video evidence of damages to the verges, trees, road signs, speeding, vehicles at a standstill with insufficient room to pass, vehicles, including HGVs, mounted pavements to get around each other, road rage and other problems. This leaves us desperately worried about our safety. We feel we were insufficiently consulted on this. The safety of the two roads has unacceptably deteriorated, and these problems are happening now, unfortunately, and 6 months of this chaos is 6 months too long. We don't accept this. And for all of these reasons, we're calling for removal of the LTN 06 scheme. Thank you.
Thank you, Dr. Mendes. As I said, that'll be referred through. Have you sent it through the petition, or do you?
Yes, we've already sent it. Yeah.
Excellent. So that will be passed on to the officers, and they would consider that as part of the review that's taking place on all the schemes, ongoing review. And they would, as the lead petitioner, they will contact you directly with the outcome. And that moves on to petition number 3, which is from Monica Stackkerzer. Sorry, I think I misspelled your name, pronounced your name. Are you on the call, Monica?
I am right here. Can you hear me?
We can hear you, yes.
And you probably might see me as well. Monica, good afternoon, everyone. Good afternoon. My name is Monika Stachurska. That was a very good try. And I'm here today to represent the voices of my friends and colleagues at Whitchurch Primary School in Stanmore regarding affordability of the car park at Wemborough Road. Ladies and gentlemen, the facts are simple. This car park remains far too expensive and out of bounds for many of us. It used to be free of charge for many years until Avanti School opened about 3 years ago. And right now, the cumulative annual cost is nearly £500. And please believe me when I tell you that for most of us, it's just far from affordable, especially those who work part-time. A large number of staff still continues to park their cars at nearby streets, but this surely isn't right, where literally empty car park is right there on our doorstep. We ask that we are granted affordable permits or tariffs that would truly reflect our needs and will become a source of revenue for the council, as more people would be inclined to use it. We, of course, would be delighted if you decided to allocate a number of free spaces to school. However, we consider 10 pence per hour to be an affordable solution for those of us on low wages, as well as annual income for the council of approximately £150 per person. This is all that we ask for. We just ask for your sympathy regarding this matter and your understanding and your support, because if you don't, there's nobody else who will. That's it. Thank you very much. That's it from me. Thank you.
Thank you very much. And so you have sent the petition through?
Oh, I have sent the petition to the council along with the signatures of my colleagues. I think there's about 74 signatures.
74, thank you. That will be referred through to the Director of Environment, who will then respond back to the lead petitioner, who I assume will be yourself.
Right, thank you very much.
Thank you very much. Simon has put his hand up. Is that for a...
Yes, thank you, Leader. Just a non-pecuniary interest in that I live in the area covered by LTN02, which has been mentioned, and I think may be mentioned a few more times in the coming few minutes.
Thank you, Simon. Are there any other petitions to be presented tonight? No, there's no hands up, so thank you very much. We now move on to public questions. As you will note from the, I'll move over to the agenda myself, but as you will note from the published agenda and associated documents, someone's got their microphone switched on that is coming through quite loudly. Oh, we can't mute him. That's it. So, as you can see from note from the published agenda and associated documents, there's been 8 public questions received from members of the public tonight. I am conscious that the questions are related to the same subject matter and very similar to the petitions, and that this is a very emotive issue for many residents. I also note that this issue has been reported and debated through 2 traffic committee meetings. The Constitution does allow 15 minutes for the asking and answering of questions at Cabinet, but I'm sure if we can keep the answers to the point and supplementary questions brief, we should be able to get through the 8 questions tonight, even if we were to slightly overrun. I wouldn't want to overrun too far. I will take them in the order published, and please note that they will be answered by Councillor Varsha Palmer as they fall within her remit within Cabinet. Just so people are aware, I will ask for the question to be read out, and that once the response has been given, the questioner will be able to ask one supplementary question, then we'll move on to the next question. So for question 1, would Heshma Shah like to ask the first question, please?
Hello, can you hear me?
We can, yes.
Hi, yeah, my question is, the Secretary of State has highlighted concerns where hastily introduced LTN schemes are having a negative impact, sweeping changes on the communities, and the need to remove LTN measures before too much damage is done to other road users, local businesses, and the lives of residents. Bearing in mind the current feedback on your website and the feelings being recorded in our petition, can the LTN schemes be reversed now?
Thank you. Varsha.
Thank you, Leader. Thank you for your question. Just before I answer the question, and this will apply to all the questions, is that these schemes were put in following guidelines set by the government in order to ease the initial lockdown by providing space for pedestrians and cycling, etc. So that was the premise for it. I do understand your concerns, and I will answer the questions that are here today, and we will move forward and see what we can do. It is true, you're right, that the accelerated delivery of the schemes to address the health emergency has meant that the public consultation that was undertaken is different from the normal process and more limited than we would normally do. As a consequence of this, a monthly review process was agreed at our TARSAP meeting for us to be able to assess the schemes in operation and to consider any issues that arise. Now, to make any changes, we will look at a wide range of factors to see what can be done, and that would be obviously the petitions, it would be the comments, it will be the feedback, it will be the data that we have our officers have as well, that we will look through and make a balanced judgment. I know that there is a lot of negativity and you want it out, but do bear in mind there are residents who actually want this scheme as well, and we were notified months before all this crisis happened that something needed to be done in that area as well. So we have to be mindful of everyone's concerns and contributions.
Thank you, Varsha. Heshma, did you have a supplementary question?
I do actually. So Grant Shapps basically quoted on the 18th of October, schemes must be balanced the needs of cyclists and pedestrians with the needs of other road users, including motorists and local businesses. We are not prepared to tolerate hastily introduced schemes which will create sweeping changes to communities without consultations, and the ones where benefits to cyclists and walking do not outweigh the disbenefits of the other road users. But also on the 21st of October, on the BBC London Radio, Vanessa Feltz asked Adam Swirsky to pledge that he will remove LTN schemes if there were an overwhelming objection from residents. Mrs. Swirsky said that if the residents want the schemes cancelled, then they would be. The TARSAT meeting also agreed that the schemes would be reviewed monthly, which is over a month now, and if necessary, removed. Will the council stand by Mrs. Swirsky's comments and the TARSAT recommendations, especially given that over 5,500 people have signed this petition to remove the schemes and over 1,275 comments on the Harrow Street-based trials, of which 1,071 of those want the scheme to be removed. Given these statistics and the overwhelming support to remove the schemes, shouldn't they be removed with immediate effect like they have been in Wandsworth and Redbridge? Well, I can't answer for Adam because I wasn't there and I don't know the whole conversation. However, as I have alluded earlier, that we are listening, and I have said that we will be reviewing, and we are doing all of that. The monthly review will be happening this month. You mentioned about Grant, and he made those comments after we started putting the schemes in. So, you know, he can say whatever he wants. He didn't contact us in the local authority. He just went and made a statement to the public. So I cannot reflect on that. I can only tell you what I know as facts from my department. Thank you. Thank you, Rasha.
We now move on to question number 2, which is from Edward O'Connor. Edward, are you there?
Yes. Hello.
I can hear you.
Okay. Good evening, leaders, officers, councillors, members of the public. We have been talking to people on the streets of Harrow, and overwhelmingly the residents we have met feel totally disconnected from the process Harrow have used to force these damaging traffic schemes through. People either felt not consulted, or if they were consulted, they felt their opinion was ignored and that Harrow were going to implement the schemes regardless of opinion. When you bear in mind the current opinion being expressed as per our Free Harrow petition of over 5,000 signatures and the comments on your website, how did Harrow Council get it this wrong?
Okay, thank you. The pandemic has created an unprecedented situation, and you know, we're all living through this, and it is having a very detrimental impact on travel. The Street Space Initiative resulted from the government issuing statutory guidance to local authorities to support more walking and cycling because of the restrictions on public transport capacity. These initiatives are being undertaken all over the country to make the necessary changes to support active travel during the pandemic. It is accepted that the pace and scale of the change may be unpopular. However, we do need to change the way we travel. It is still important during the crisis that we address the ongoing travel issues and support the key services and the public health. Thank you.
Edward, did you have a supplementary question?
I do, yeah, please, yeah. So the related question is, 75% of respondents in the original limited consultation were against the schemes. We have since sought local opinion and found almost unanimously that people do not want these schemes. Some of the difficulties it is causing people are considerable, and it is distressing to hear feedback from residents whose quality of life has been adversely impacted. The results of the council's limited consultation were misinterpreted by the council and skewed so as to be in support of implementing the schemes. The council failed to carry out due diligence to substantiate the officer's findings. Do you believe that it is appropriate and democratic that Harrow Council can implement life-changing schemes without thorough public consultation, given that just 500 people responded to the original consultation?
Thank you. So there's 2 points there. In the past, we have had residents approach the council saying that something needed to be done in that area. So we would always look at that. On this point, yes, it's 500 or whatever, we did consult. It's up to people to respond to the portal, etc. And it is, as I have said earlier, that it is to do with making it easier for people to move around the borough because of the lockdown for social distancing. And I have said, and I will continue to keep saying that we are listening, we are reviewing, and we will do whatever we need to do in order to make or adapt the scheme. So, you know, we will look at all the evidence that is there and make the decision that is suitable, and that will help the residents in that area.
Thank you. We now move on to question number 4. Sorry, question number 3. Question number 3, which is Kevin Mahone. Kevin, are you there?
Yes, indeed. Thank you. Good evening, everyone. My question is this. There appears to be certain contradictions about whether the LTN2 should have been included in the scheme, with some believing it should have been included and others under the impression that it had been deleted from the scheme. How did this confusion occur?
Thank you. As far as I'm aware, there is no confusion. The scheme was approved for implementation in the Special TASAP meeting in August.
Kevin, did you have a supplementary question? Although I recognise your internet's a bit fadey.
Yeah, sorry about that. I hope it comes through. Thank you for that, Barsha, if I may call you by your first name. But my supplementary question is this. Especially bearing in mind, we just heard news that there's a fund for the clinically extremely vulnerable people in the borough of £161,000 specially allocated at this period of time. There are 2 care homes for vulnerable adults in Parkside Way. We have an affidavit signed by the care staff and the residents of the homes giving details of the extreme distress the roadblock in particular and the wider area generally has. Can you confirm, therefore, that you took insufficient or no regard to the brutal impact these roadblocks have had on the health and well-being of these very vulnerable people in Parkside Way and other people, vulnerable and not vulnerable, in Parkside Way and the wider area?
Well, like I said, the portal is open for people to make their representations, and we would do whatever we can to make it safe for all our residents. So, as I said to the others earlier, I will look into that and I will review that with my officers.
Thank you.
Thank you.
We now move on to question number 4, which is Mia Galabi.
Yes,
I hope I
good
pronounced
evening.
that correct.
I'm Miep and I was born in the Netherlands and I grew up cycling and I cycle daily. I'd like to ask that when Sadiq Khan launched the street space plan in this year 20, in May 20, he included some of the recommendations as being emergency cycle lanes, widening pavements, 2 miles per hour zones, low traffic neighborhoods, and he expected the local authorities would engage constructively and adequately with residents to make sure that the changes are the right ones for the community. Why did you not look at the diversity of our community and consider some of the other options, like widening the pavements so we can have a shared space with different colors or textures for pedestrians and cyclists? As in our neighborhood, it looks like most cyclists still feel safer on the pavements, particularly cycling with younger children.
Thank you. As you know, that the council has introduced the measures to support both pedestrians and cyclists in the programme in accordance with the guidance that was given to us by the Mayor of London and TfL. The pedestrian space measures were located in shopping areas and at transport hubs where there's a greater pedestrian footfall to support social distancing. The cycle lanes use main routes to connect different centres to the borough and provide safe and direct routes for cyclists. And they were introduced as emergency measures. That's why the consultation was limited and done on the portal. Thank you.
Maria, did you have a supplementary question?
I'm gonna let that go because I feel I want the other questionnaires to come in as well.
Okay.
Thank you. Thank you very much. So we move on to question 5, which is from Beth McDowell. Reshma, are you there?
Hi, good afternoon, everyone. My question to Varsha is, in relation to the petition that has just been presented, do you acknowledge the excessive negative impact and adverse outcomes, such as increased volume of traffic, including HGVs, on two particularly narrow roads, speeding vehicles, incidents of road rage, physical damage to the road, and fundamentally the deterioration of safety of residents, particularly children, as a result of LTN 06 on the residents of Priory Way and Manor Way?
Thank you. I think you've just asked question 7. As explained in my previous answers, you will be aware, we are aware of the recent public feedback for the 2 roads that you mentioned, and that the increase in the traffic caused by the wider restrictions in the area. And as I've said, I am reviewing that, but also to say that it is a 20-mile-per-hour road or area, so therefore there is a 20-mile-per-hour within the area. So therefore, if there is road rage going, etc., then the police maybe, should get involved, because that's not acceptable, is it?
Okay, can I respond?
You can ask your supplementary
question. Okay, given the 20-mile-an-hour speed limit, no one is acknowledging or abiding by the 20-mile-an-hour speed limit. Given the excessive negative impacts of LTN 06 on our 2 roads that have been extensively documented by us, and as per the written statement from TARSAP acknowledging that should any excessive or negative impacts occur as a result of the scheme, then there is recourse to amend or remove the scheme if necessary. Will you remove LTN 06 as per your original promise and statement? We can't wait 6 months, and we call for this to be removed immediately.
As I said earlier, I am reviewing and I am listening to the residents, and I will look at all the evidence that is presented to me, and I have the comments that you will have given to me. So I will look through all of that and make a judgment as to, how the next steps and the way forward, so that we can alleviate the issues that you have mentioned.
Thank you. We now move on. We have gone past the 15 minutes, but if we go on to question number 6, which is from Samantha Pally.
Yes. Hi. Can you hear me?
We can hear you, Samantha.
Okay, hi. There is a slight overlap with the previous question, but I'll just run through it quickly. So first of all, thanks for allowing us the panel for allowing us to ask questions. I live on Manor Way, and my daily quality of life has been hugely affected by LTN 06, and by now having regularly diverting traffic, much of which is speeding traffic down our narrow road as a result of shutting Southfield Park. Yet we were never consulted. We'll remove it immediately until they do a correct and proper consultation with the residents of the neighbouring 2 roads, i.e. Priory Way and Manor Way, and also the houses directly affected in Headstone Lane and Parkside Way, who've also become overnight high risk and high traffic neighbourhood areas. Can I have your thoughts on that, please?
Okay, public consultation on this particular bit was undertaken, and a leaflet drop was also done. And we, as I've said earlier, that we would regularly monitor these schemes on monthly basis, and this is due this month actually. And any problems, as you have alluded to me now, would be looked into and remedial actions taken. So, like I said to your previous colleague, I am aware of the situation and the concerns that you have, so I am reviewing that. Thank you.
Samantha, did you have a supplementary question?
My question is, if the schemes are to stay for 6 months, it seems, and a child or adult is killed or injured as a result of these traffic schemes, or emergency services can't reach a resident in dire need, it appears that the council has deemed that an acceptable level of risk for the 6-month period. And in the past, a child has been killed on Manor Way as a result of traffic accidents. And it seems like the council are putting their aims to get this pot of money ahead of the risk to those people in this area. And your council democratic officer earlier in the day confirmed that the next TARSAP meeting is scheduled for the 2nd of March. And that's far too long, given that there's a daily risk to life here.
Okay, so firstly, it's not about chasing the money. It's about safety of the residents. And secondly, as I said, that we are looking at the scheme to see a way forward for you because of the concerns that you have alluded to. So, you know, I don't know how many times I can say this. The emergency services have been contacted, and we speak to them every week and daily. So they haven't said that there were concerns, because what they do is they put in the timings and they would let us know if there was an issue, etc. We speak to them every week and daily to make sure that there's no impact on them as well. So it isn't that we don't talk to people, our emergency service, etc. We do talk to everyone, and we're doing this as a partnership with them as well.
There's a lot of families and young kids, and their lives are at daily risk.
Thank you.
March is a long way.
We're going to move on to question number 7, but I think that was asked earlier on. But
yeah, that one's already asked.
But Karen Jolliffe, your question, which was question number 7, I think was just asked by Reshma Shah, but
yeah,
if you're there.
Yeah, good evening.
Right, so which question are we asking now?
Question number 7.
No, but that's already been asked and I've answered it.
Wait, regarding the emergency services? Shall I ask my question and then you decide?
Well, ask the question anyway,
Yeah.
Karen.
Okay, I live in West Harrow and am directly affected by LTN 04 and further by all the LTN my journeys to work. Have the council completed a risk assessment on how much longer it takes emergency vehicles to respond to our locations?
Okay, so yours is about the risk assessment. We have done consultation, as I said, and we did the leaflet drop. The proposals were also publicised on the community engagement portal, and we received the feedback, which was reported to this TARSAP meeting, where the scheme was recommended for implementation. All schemes are risk assessed to ensure design standards are met. And as I said, that monthly reviews would be done as agreed by the TARSAP meeting in order that we can assess the schemes in operation as they are in there. And like you said about the emergency services, we speak to them daily and ensure that we understand if there are any impacts.
Do you have a supplementary, Karen?
Yes, it was. What were the emergency services comments when you approached them directly about your proposals?
At this moment in time, there is no issue, but like I said, you know, it's a fluid situation. If things change, we will amend, we will adapt as necessary.
Okay, thank you.
Thank you. We have gone over, but we only got one question left, so we move on to question 8. Prash, you started it off with the petition. Do you want to finish with the last public question?
Thank you, Leader. Actually, given how much of a stellar job you're having to handle all these questions and what you've got, I'm going to hold down on that question. I want to thank all my Free Harrow colleagues for, you know, being so cool and calm, and thank all of you for having the patience and the dignity to give us our chance and voice. I think the things that we've been raised will be adequately met with receptive and empathetic ears, and we look forward to a positive and a constructive dialogue going forward. Thank you.
Thank you.
Thank you very much. So that does conclude the public questions. So thank you very much, Prash. We now move on to the council questions. We've received 6 questions. It's 1954. So the first question, number 1, is from Marilyn. Are you there, Marilyn?
I am. Thank you, Leader. This question is to Councillor Keith Berry, who is the portfolio holder for regeneration, planning and employment. Does Councillor Berry take climate change seriously? And if so, what action is he taking to ensure that the Council's regeneration programme avoids making a negative contribution to an already challenging situation?
Thank you, Marilyn. The Council, like many others across London and beyond, has declared a climate emergency. I am personally supportive of taking action in this area, and both I and the rest of the administration take the issue very seriously. Our draft climate strategy aims to work towards carbon neutrality, whilst also recognising there is a requirement to bring forward much needed new affordable housing in Harrow. Consequently, we need to take steps to minimise the environmental impacts of such developments. This includes firstly ensuring that the new development is delivered via sustainable procurement practices so as to reduce as far as reasonably possible the greenhouse gas emissions that arise during the construction process. And secondly, to ensure that the buildings once constructed are highly efficient as regards their ongoing energy usage, also providing for low carbon and renewable heating, and where appropriate, low carbon and renewable on-site electricity generation. In relation to the Council's developments currently underway, I am reviewing the design of the Haslam House and Waxwell Lane developments, which I believe went through planning prior to the climate emergency announcements, and I will come back to you shortly on what will be changed. In relation to the larger programme of future developments to be delivered by the Harrow Strategic Development Partnership, I have been impressed by the credentials of our preferred bidder Waits with regards to sustainable and low carbon development. I look forward to working closely with Waits to ensure that the proposals for the redevelopment of the Council's strategic sites are worked up further and they are done responsibly and in a low carbon way. Delivering high quality, comfortable and eco-friendly new homes for the people of Harrow is our main priority.
Yes, thank you. I have a supplemental question, Leader. I've said this before, and I'm going to say it again. And you've spoken about homes, Keith, but I want to talk about something else. You see, coronavirus has changed the working world, and it is very unlikely that we will see a return to office working like before the pandemic. And your plans for a new civic centre were designed and thought about for a pre-COVID world. It is now clear that with most of our officers working from home, we really don't need to build a big, new, fancy, expensive, multi-million-pound civic centre. And frankly, it would be completely unnecessary to do so. It would be a waste of time and effort and resources and taxpayers' money. The building would be obsolete before it would be even finished. And I'm going to ask you this again. Will you please properly reconsider your plans in the light of these changing circumstances?
The short answer is yes. We're looking at post-COVID designs for both the new civic centre, for the houses that are going to be built on the present civic centre site, and the houses that are proposed for the leisure centre site. But particularly in relation to the new civic centre, we are revising the accommodation strategy and schedule, and they will be coming to Cabinet in future. We're looking at the changes in work practices that we will need to implement, not just because of COVID, but I'm sure this isn't the last pandemic that we ever going to have to suffer in the course of the use of the new civic centre. We have to make sure that it is capable of meeting any other infectious disease pandemic that may come along. Naturally, this will probably result in a much smaller civic centre and a more efficient civic centre, because we do expect that some, if not all, or the majority of our council employees will be working remotely in the near future. And I look forward to working with Waits in reviewing the complete design of all of our development projects.
Thank you, Keith. So we now move on to question number 2. Marilyn.
I'm afraid it's me again, Leader. This is also to Keith Ferry, the portfolio holder for regeneration, planning and employment. In the light of the considerable amount of public concern about all 3 TfL car parks coming up, Will the council scrutinise Canons Park, Stanmore and Rayners Lane and treat them in an equitable and even-handed manner?
Thank you, Marilyn. The answer is a bit shorter. Yes.
Oh, that was a nice short answer.
Did you have a short supplementary question, Marilyn?
No, it's not that short, but because of the nice short answer, I will try and be brief anyway. You see, unfortunately, what matters about this is what the man in the street thinks. And people do express their concerns to me. And they are saying, and frankly, I wouldn't disagree, that there are no coincidences here. I could add that I would better vet some of the people that come along to your Labour Party Harrow West meetings, because a number of them have advised us that this was discussed at the meeting, and it was decided that it would be very much better if the Rayners Lane development car park, TfL development, was not going to go ahead at the moment. And frankly, it's because, let's be honest, it wouldn't look very good if the Labour councillors on the planning committee voted against a car park that has an equal number of objectors in a Labour area and voted for two very similar proposals in a Conservative area. Now, I'm sorry, but the Rayners Lane car park has conveniently been put to one side, and we don't think, and frankly, neither do any of the residents that have contacted me, that this is right. And therefore, I will ask you, and I'll ask you this one more time, are you sure that there has been no political interference in this process and that all three of these applications will be dealt with fairly, so that the people of Stanmore can have confidence in the way that under your watch this council is being run? Thank you.
There isn't, as far as I'm aware, been any political interference or any discussions with officers. As you know from your vast experience of planning, all planning applications follow a standard process in which each site is assessed individually against the council's planning and transport policies and the strategic fit of the development considered before being submitted to the planning committee. It's not up to me to decide which applicants should apply for which planning permissions. It is a case that once the planning permission is submitted to the council, then we have to scrutinise it in addition to against all of the relevant planning policies. And I can say that the officer's report to the planning committee will include a summary of all representations made from residents, and these key points will be addressed within their report, I hope.
Yes, except that you missed the point. Thank you.
We now move on to question number 3, which is from Councillor Anjana Patel. Are you there, Anjana?
Yes, I'm here. Can you hear me?
Yes, you got a question for Varsha.
Yes, question is for Councillor Varsha Parma, portfolio holder for Environment. I would like to wish you a happy Diwali, first of all, and to everyone who is celebrating Diwali. Do you think, or do you still believe that the new cycle lanes you introduced in Honeypot Lane and Uxbridge Road are a good idea, even though they have substantially increased congestion and delayed an ambulance? Can't hear you.
That's better. Thank you for your question, and happy Diwali and Samal Mubarak to you as well. Supporting cycling and active travel during the pandemic is very important for public health and providing alternative ways to travel. The evidence has shown that usage of the cycle lanes during the week has increased since we have introduced them. As part of our monthly review of the schemes, the feedback received from local cycle groups is that the cycle lanes have made cycling safer on these main routes, and they are very supportive of these. As to the congestion, it's not any different to what it was before the pandemic, and the emergency services have not reported any issues. However, we are in daily contact and weekly contact with them. If there are any issues, then we will work with that and sort out and make amendments as necessary. Thank you.
I have a supplement. I am really surprised that you think that the congestion is the same as before and hasn't increased. But anyway, my supplementary question is, how many cyclists did you expect to use these cycle lanes, and when you planned them? And do you know how many cyclists have used them since they were installed?
Okay, so the whole idea was to open up so that people can cycle safely. And also, as you will know, that it's part of this route, the honeypot that you're very passionate about, is also part of our strategic cycling route that we were going to implement, which was mentioned in our 2013 vision for cycling. So it's not anything new. It was something that was going to happen sooner or later. It's just fortunate or unfortunate it's happened now.
Thank you. We now move on to question number 4, which is Councillor Christopher Baxter. Chris, are you there?
Yeah, I'm here. Can you hear me?
Yeah.
We can hear you, yeah.
Thank you, Leader. Yeah, my question is to Councillor Varsha Palmer, portfolio holder for the environment. Before implementing new traffic schemes, what assessment is made of the impact on neighbouring roads which fall just outside the scheme?
Thank you, Christopher. Lovely to see you. There are a very wide range of traffic schemes, and each type has different requirements. So it is difficult to generalise and say this is, one thing. Say, for example, a CPZ, usually we would undertake a before and after traffic surveys to monitor the impacts. And there is an extent and range of service that would, depending on the scheme. So they could include traffic counts, parking occupancy surveys, and the officers actually going on site and monitoring, etc. So there are different ways that we would do that. Thank you.
Did you have a supplementary question, Chris?
Yes, Leader, I do. When you implement a road closure at one end of a road, for example, traffic doesn't just disappear, it simply flows down neighbouring roads. To anyone who knows Manor Way and Priory Way, it's a statement of the obvious that drivers cut through, and they have been cutting through for many years, from Headstone Lane to Parkside Way, through Manor Way and Priory Way. It also seems obvious that if you close Southfield Park, as the recent scheme has done, the displaced traffic will simply end up on Manor Way and Priory Way. So to reiterate my first question again, what assessment was made of the impact specifically on Manor Way and Priory Way from the new scheme, the LTN 06 on Southfield Park? Thank you.
Okay, Chris, thank you for that. Just to reiterate myself that this is a scheme that's put in through because of the government guidelines and the money that was from the TfL, so we have to follow the guidelines. And as I have said before in the public questions, that we were limited in the way we did the consultations, although the portals were open and we did receive the comments, etc., and we continue to do that. And as I said to the public questioners, that I do listen to the residents, I am reviewing, and I will see what way forward I can make with the officers and with the information that's available to me, be it the petition, be it the data and the survey that we do every month, and also the comments made by the residents and yourself, of course, because I know you're a ward councillor there.
Thank you. Thank you very much.
Thank you very much. We have reached the 15 minutes, but we have Councillor Richard Ormond. We can be brief, can't we, Richard?
I'm always to the point. I don't mind waiting nearly an hour and 3/4 to ask my questions, because as you know, I always sit through these meetings, but members of the public shouldn't be treated with discourtesy and be made to wait over an hour before they can start those, and I hope that won't happen again. Anyway, my question is to the leader. When was democratic control of the content of the draft borough plan abandoned?
Well, on your first question, the presentation is about a live issue around COVID, and it is because we're right in the middle of a pandemic and we're at a complete lockdown and the services of the council have changed. But with regards to your actual question, I'm not really sure I fully understand the rationale for your question, as the updated borough plan is being considered by Cabinet this evening. And given as Cabinet is the political executive of the council, the fact we have it on the agenda is a clear example of political control and democratic control. The borough plan has also been discussed and challenged at scrutiny, which gives that broader democratic control of the content, and the plan will also be considered by full council in a couple of weeks' time as well. So again, we'll allow political oversight in it. In view of the number of meetings where this item has been on the agenda, I remain very comfortable with the political control and the democratic oversight of the borough plan.
If you don't understand the premise of the question, you should read your own papers on the agenda tonight. Page 29 refers to two options in respect of response or otherwise to Black Lives Matter protests and other matters. One option being not to change the draft borough plan, the second one being to change it. The option not to change it, the report says, was rejected because of feedback from staff and the Black Lives Matter staff group. I'd always understood that policy was made by the elected members of the council and officers were paid to implement them. Why is that not done here when an option is dictated by the staff? Staff who live in the borough as residents are entitled to be consulted, but can you tell me why staff member, for example, who doesn't live in the borough apparently is given a higher priority as regards consultation than my residents in Pinner South and everybody else's residents in their wards?
In consultation, everyone gets equal value. It was felt as the leader of the council, I'm responsible for the borough plan, and I have considered all the responses that we've had so far, including from the voluntary sector and the community sector, who have written in and asked about certain aspects of the plan. We felt there was a gap within the plan, and that's why it's been addressed and amended tonight. You've got question number 6, I do believe.
Yes,
as well.
Do you believe that our local police discriminate racially against black people?
I don't think anyone would disagree with the fact that people of black heritage are disproportionately impacted by things such as stop and search, or that people from a black heritage are disproportionately represented in the criminal justice system. The Lammer Review, for example, which considered the latter, clearly demonstrates this as a fact, and this was followed through the Stephen Lawrence Review. However, do these facts mean that our local police discriminate against black people? No, they don't. But this also doesn't mean that organisations like the police and councils can't do more to genuinely understand what we need to do so that black people have the same life chances as people from other ethnic backgrounds, and that we put in place the meaningful actions that will make this happen. Our own adoption of the new cross-cutting priority in our borough plan, which you just alluded to recognise and act to counter racial disproportionality, especially for people from black heritage, is a step towards making such a meaningful difference. I therefore hope that you would join me in welcoming both this change to the borough plan and also the action set out in tonight's Cabinet report on the council's response to Black Lives Matter.
If you don't believe that local police discriminate racially against black people, why are large sections of two reports, the one on Black Lives Matter responses and the one on the borough plan, devoted to recitation what are apparently national statistics on rates of arrest, rates of fining people during the lockdown, for example? Is it just to make a rhetorical point? And I hope not, but is it to pander to part of your political base? If it's not, why aren't you in a borough plan reciting statistics that are local and therefore relevant to the formation of our plan?
As you'll be aware, Richard, the police data is collected across London, and it doesn't devolve down as far anymore to the borough level. We do have the Safer Neighbourhood Board if they want to meet, and they have this on their agenda to challenge, since the McPherson reports, that's what's been brought in, that they have that within their remit to challenge. But what we do know is that all the reports that have come through and were mentioned in the motion at council in July, and including the reports from the it's one of those afternoons, but when we spoke about the Marmot review and the information that came through there. All of it is London based. But what it is Richard, we tried saying this when the motion was carried. It's about perception of what how people see. It's this unconscious bias that sits within across a whole range of services. And the Black Lives Matters group have brought that to the front, and it's worth looking at those webinars to really understand what people think of how they're treated and their response to it. And it's so on your question, to answer your question, I haven't I? just said that we brought it in because we think it's necessary to really start addressing some of this. It's been ignored for so long. It's been challenged for some time. It's about time we actually started moving ahead with it, and that's what the plans are planning to do. So thank you. We now move on to the key decision schedule, which is on page 7 to 24. Can you please note that the long lease opportunity to provide newly built homes for use as temporary accommodation or discharge of homeless duty has been moved from November to the December Cabinet meeting. Can you note the key decision schedule, please? Thank you. Progress on scrutiny projects is detailed within the Cabinet report. Can you note the update, which is on page 25?
Noted.
Okay. Thank you. We now move on to item number 9, which is the borough plan update. I just want to do a brief introduction, and I want to hand over to other people to take this through. When the draft borough plan was first published in pre-COVID times in February, we had hoped to use 2020 as the year of engagement, and this has not been possible due to the outbreak of coronavirus, or the consultation would have been completed by this evening's meeting. As outlined in the Chief Executive's presentation at the start of the meeting, we do have a challenge with our capacity to develop the council delivery plan, which has been one of the choices we have had to make in order to focus our efforts and limited resources on the immediate need to manage the second wave of the COVID pandemic. However, as the report tonight highlights, we have made significant progress across the 8 priorities we agreed back in February, despite dealing with the pandemic, and some of the main activity to date is set out in the report. The 8 priorities are about sustaining quality education and training, celebrating communities and cohesion, maintaining low crime levels and improving community safety, improving the environment and addressing climate change, tackling poverty and inequality, building homes and infrastructure, addressing health and social care inequality, and thriving economy. And there's a number of examples amongst all those policy structures in the reports. We've all learned a lot over the past 9 months. The world has changed in so many ways. So it is only right that the report tonight proposes that a borough plan be amended to include three items. So the 3 new corporate equality objectives, which are set out in this report tonight, and in more detail in the next report on the agenda. A new overarching priority around tackling racial disproportionality in light of the Black Lives Matter movement. And thirdly, to take account of the impact the evolving COVID emergency is having on our thinking and actions in relation to the borough plan, and fits in with our own agenda to build back better. As leader of the council with over responsibility for the plan, I am very proud of these achievements to date in the face of the pandemic, which is down to the efforts of our amazing and dedicated workforce. We have Alex Dewsnap and his team in the council, and we have representatives from our partners across the public sector and the voluntary and community sector organisations who are working with us to ensure the plan delivers for Harrow residents, not just now, but also into the future. So I would like to invite Councillor Antonio Weiss in first to speak on the report. Antonio has spent a lot of time working on this report, working his way through the reams of data to ensure it makes sense, and also to ensure that it sets out the direction of travel we'd like to take. So Antonio, if you're able to join.
Thanks, Graham. Thank you, and I'd just like to add, I think clearly, as many of the discussions have covered this evening, these remain challenging and extraordinary times. And one of potentially the gentlest but nicest critiques, I think, early on in the borough plan was that it was very ambitious, and we were, I think, quite proud of it being ambitious. And I think what I'd just really like to highlight is the extraordinary work of officers and colleagues and councillors and others across the borough and partners as well, who have helped to continue to deliver across those priorities. So that's everything from securing green homes grants to retrofit low-income households to make them more energy responsible and better, establishing the community hub, which we know has reached out to over 28,000 households, and new street art across the borough, and indeed, of course, progressing our major strategic development partnership, and much more besides. These are enormous achievements in any times. To do that in the face of a pandemic is an extraordinary testament to the courage and dedication of all of those involved. So it really is just from me a thanks to say, you know, we know that there's hard times ahead and lots of hard work, but we're hugely grateful of the amazing efforts of all involved.
Thank you very much, Antonio. I see one hand up, which is Councillor Paul Osborne. Paul.
Thank you, Graham. I mean, to me, this is just one of these examples of things that you thought were paused and we thought we didn't have the capacity to do, and then all of a sudden it bubbles up again as a thing. I mean, to be clear, this is a policy and a document that would have come to February Council anyway. So I'm unclear why we're doing it now, other than we've decided that sticking in a kind of few bits about inequalities was important, and why that couldn't have waited until February, I don't know. I was very disappointed to see it talks about COVID, but actually there's very little in it about how we are going to build back better from COVID. There's very little in it about how we create a thriving economy, given some of the changes that have happened. But the thing that comes to me overwhelmingly is the lack of self-awareness in the bit at the beginning where it talks about some of the progress that we've made. Yeah, everything in there is good and there's no issues that are flagged up. Some of the things that are set as progress I find quite bizarre given the conversations we've had earlier. I note that the first item is that in the first bullet point, we've secured £638,000 for streets scheme and changes to cycle lanes. If the Cabinet really regard that as progress, if they really regard that as a good thing, then good luck to them when the elections come up in 2022. I would note, and I'm quite proud to say, none of those low traffic neighbourhoods are in Conservative wards, because our councillors have represented the people who elect us and have ensured that they were stopped. The trouble is they're all in Labour wards because Labour ward councillors were all in favour of these schemes. And it's important that people watching understand that. These were only put in because ward councillors didn't object. It wasn't anything to do with the government. Schemes were stopped in Stanmore and they were stopped in Kenton. They weren't stopped in Headstone South and they weren't stopped in other places. West Harrow, there's one that again sticks to mind. So I would just say in all of this, if you are going to claim that there is not enough capacity for these things, if you are going to claim that there's all this extra work, which I think I would agree with, then why do this now? And why not actually do this in February when the whole thing can be looked at with a much more reflective thing? Because I think we'll be much clearer by then where we are with COVID, where we are with any future vaccine, where we are with the testing regime and the rapid testing. All of that will be a sensible discussion to have. And clearly part of that will be the Black Lives Matter thing that's come up since the last thing that was discussed in February this year. But to do it now just seems to me the wrong time to do and the wrong priority for the council.
I totally disagree with you, Paul. I see the borough plan as giving it a direction of travel, not just now, but into the future. And without it, you're sort of careering along rudderless. But I suppose that's the way you would like to run an organisation. As we move through COVID, people want to know how we're going to get out of it and what those priorities will be. They want to see that direction of travel. And we'll just pick one of them around poverty and tackling inequality, where COVID has shone such a spotlight on it. By having that direction of travel, working through and understanding what we can do about it, we can then focus services as we rebuild out of a pandemic. And I must say, this pandemic has been the worst managed pandemic by any government in history. It's been appalling. The guidance that has come out, the statements are made, 4 or 5 weeks later, the guidance comes out that doesn't agree with what's been said at the time. And when something has been going through, the minister will turn around and say, I didn't really mean it like that. And I think that's totally unacceptable. But actually what I do find unacceptable, Paul, is the words you used just now is saying, wasting our time sticking in a few bits about equalities. These parts on it are key to why we're moving the report tonight, to make sure we understand what people feel like in this borough. We are a very wide-ranging, diverse borough in Harrow, and we listen to a lot of residents. This is how they're feeling at times, and it's about time that we took stock of what we're doing and move on. But this is to giving us the guidance, not just to get through the pandemic, which it has done so far, but how we could get out the other side as well.
I think that would be slightly more convincing if you hadn't spent the last hour and a half ignoring the residents of Harrow, who are desperately trying to tell you of the inconvenience and trouble they're finding due to the low traffic neighbourhoods. When you talk about the direction of travel, the problem is the council is stuck in a traffic jam with an empty cycle lane next to it, whilst Councillor Palmer is pretending there's all this increase in cycling. The fact is, I've been stuck in traffic along these things, as have lots and lots of people in Harrow, and all we see is empty cycle lanes staying there without a single cyclist hour after hour. It's just ridiculous that we're doing this. But as I said, I think these are important issues when it comes to Black Lives Matter. It does need to be discussed, but it should be discussed in the context of more information as we get through this lockdown, and done sensibly alongside the budget in February, not done in November, a few months away from the next time it's discussed.
We keep going around in circles with you, Paul, you know, but about low traffic neighbours, and I'm not going to carry on with the conversation around it, because I know what the government has said, and I've spelt that out to residents and had those conversations, exactly what it means. The requests for those schemes came in from residents. If we'd have been given the right time, if we'd have had a proper government in place, to be fair, if we'd have been given enough time, we would have consulted a lot before some of these schemes. We've been discussing consulting for a number of years around what to do around Wildstone, and the funding was coming through for that pre-COVID. So we can do it exceptionally well, but when you get told to put it in and then consult after it's in, that is just what the instruction is, or you give the money back. So was there any other comments to be made? Antonio.
Well, I think I might just gently suggest that you might try and pick which of the battles you wish to fight a little cleaner. I understand the desire politically to try and make this about something else. But to be clear, the reason why this continues, i.e. why the priorities in the borough plan have to be progressed, is because of the incompetence of a Conservative administration that can't handle a pandemic, unlike many other advanced nations in the world. So we're having to keep on improving things in Harrow whilst dealing with a pandemic, purely because of Conservative failure. And we make no apologies for that.
Totally agree, Antonio. So if we go back to the recommendations on the report, I can't see any other hands up. I'm just looking for the recommendations. They're on page. Oh dear. There's me saying that IT would working very well, and now mine's not working. So the recommendations are on page 27. Are they agreed?
Agreed.
Yes.
Nodding.
Agreed. Yes, agreed.
Thank you. We now move on to item 10, which is the council's response to the Black Lives Matter. And this seems to have caused quite a bit of dissension or concern by some people. But I just want to sort of put on record that when the motion was carried by council in July, we have not stood still. The motion highlighted issues disproportionately experienced by people of Black heritage across a wide-ranging area of the public sector. Harrow prides itself on being one of the most ethnically and religious diverse boroughs in the country, with people of many different backgrounds and life experiences living side by side. However, we recognise that the council can do more to enhance lived experience and better outcomes for all staff, service users and communities. The report tonight sets out the first steps that the Council is taking a new approach to equality, diversity and inclusion in Harrow, and that's often referred to as EDI. Our goal is to address the issues of disproportionality experienced by all protected characteristics, but we are specifically starting with a focus on disproportionality experienced by those of Black heritage, as this is where the greatest injustices are currently felt. COVID has shone a spotlight on health inequalities and lower income families, and the report sets out stark reality. Levels of unemployment are at least double for Black people than they are for white people, and when in work, Black people are paid less on average than white people. People from varying backgrounds are up to twice as likely to die from COVID than white people of white ethnicity. In Harrow, you are 7.5 times more likely to be homeless if you're a Black than any other ethnic group. A number of actions have already taken place and include a review of the borough plan, which we spoke about just now, and the inclusion of an additional theme for equalities, diversity and inclusion. The Chief Executive has been appointed an executive sponsor for race, appointed a temporary senior policy officer from the policy team to undertake work on the agenda on a full-time basis. A couple of months ago, I appointed Councillor Varsha Palmer to be the cabinet lead on the work taking place politically, and a cross-party members group has been established to provide political insight and strategic direction for our response to the issues raised through the Black Lives Matter and the broader equality, diversity and inclusion strategy for the Council. In a moment, I'll ask Varsha to say a few words about the work of this group. A range of work is taking place across the Council, reviewing the current corporate equalities groups and processes to inform new working arrangements, and an equalities, diversity and inclusion strategic framework has been developed, which is on page 83 of the agenda tonight and will inform the EDI action plan. Service reviews are taking place and action is being taken as an employer, being supported by an independent consultant who has been appointed to undertake engagement work with all staff, and we have signed up to the Race at Work Charter. A newly established Black Lives Matter staff group has been launched, which has been sponsored by Sean, and I will invite Sean to say a few words about that in a moment. I would like to conclude by saying that I'm in awe with the amount of work that has been undertaken by the Black Lives Matter staff group in such a short space of time. And I'd love to say a lot of it has been undertaken in their own time. And as an example, as part of Black History Month, a number of educational webinars were organised, which included Patrick Vernon, OBE, Rob Neal, OBE, Kim Smith, Chief Executive Hammersmith and Fulham Council, and the Right Honourable Stuart Lawrence, the brother of Stephen Lawrence, who was murdered 25 years ago. These webinars are very informative and are available to download. The report sets out the work that has been undertaken in a short space of time, and those involved should be congratulated for their tenacity and commitment, bringing their life skills to a programme of work, with many of them doing it in their own time. So I'd like to say thank you to them. I'd also like to just quickly ask Varsha to say a few words about the working group, and then Sean around the work that's taking place within the council. Thank you.
Thank you, Leader. Just before I start, I'm just a bit disappointed with Paul Osborne saying that he thinks that inequality is not important to be put forward, and he is part of this cross-party group. So I find that very disappointing, Paul. As a chair of the Black Lives Matter cross-party group, since the motion in July, we've met a couple of times, and out of the three main themes, we are looking at the take action as an employer. We will be looking and giving feedback on policies, training, recruitment, and all aspects regarding council staff and as an employer. Now, this is a very complex subject and a emotive one, but needs to be addressed. And that's what we are doing. It is hard and it's difficult because conversations that are had are hard for people to convey how they feel, etc. Now, we've met the consultant, Patrick Vernon, OBE, who's explained his remit, and he will be coming back in the new year and will share some of his initial findings with us. And we are working with our HR Director, Tracy, inputting on various elements of the policies, etc. I've also met the Black Lives Matter Council group, as Graham has said, that they are doing this on a voluntary basis and they are very passionate about it and they have put a lot of effort in, and they are a very informed group. And last month, to celebrate Black Lives Matter, as Graham has said, they set some webinars with Patrick Vernon, Rob Neal, Kim Smith and Stuart Lawrence, again, brother of Stephen Lawrence, who was murdered. We agreed that Black History Month and other celebrations are very important and that we should celebrate all year round. We have a great diverse workforce and a borough that is full and rich in culture, and therefore we should harness this and collectively work towards putting and getting the best outcomes for everyone in order to address the inequalities and the gaps that we face at the moment. And I look forward to working in the group with Sean, with Graham and Patrick, and obviously Tracy, and take this forward so that we can have really some positive, sustainable outcomes that are there for everyone and everyone feels inclusive and included in what we are trying to do and feel part of it, because everyone is affected. Thank you, Leader.
Thank you, Varsha. Sean.
Yes, thank you, Graham. I've spent about 30 years in local government and always cautious and measured in how I appear to step into a political debate at a cabinet meeting. So I will seek to choose my words carefully and balanced as an independent officer advising the cabinet. I think the point that I want to make is that in terms of making that balanced advice, I completely understand that there are concerns about how much capacity and effort and resource that the council is able to put into any issue, given the fact we are in the middle of a global pandemic. And I genuinely understand concerns expressed by members about how our ability to do that, given the fact I spent the first 45 minutes of this evening's meeting sharing the level of challenge and concern that we have. So I do genuinely understand why Paul and other members have raised issues about our capacity to deal with this. I think what I also want to say, though, is that literally from the day of the death of George Floyd, I have had staff from across the council coming to speak to me about their level of concern, about what those messages are, what that meant for them in terms of their personal experience, and similarly, the amount of confidence and views that the staff have given me about how proud they are that the council has highlighted responding to Black Lives Matter and tackling equality and diversity as being something which they have not seen in Harrow in the recent past. And I guess for me, that I think that if we don't make an effort to prioritise our work around this agenda now, we have a real risk of losing our staff. And 65% of our staff are from a Black and minority ethnic background, and many of them have been very impressed both with the work that the council has done on a cross-party basis and a leadership level and at a senior level to take this issue seriously and to stand up and step forward and say this is something that's incredibly important. And I believe that whilst absolutely, and I've had this conversation with the Black Lives Matter staff group and other staff, we cannot push forward as hard and as fast on this agenda as we would want to do so if there was no pandemic. And I think that's absolutely true. And I have articulated that discussion with the staff. But I also think as well is if we don't continue to make progress, particularly on our role as an employer, during this time, we have a risk of losing our staff, many of whom are passionate about and really supportive of the role that the council has played over the past few months in order to be able to highlight the issues that are contained within this report. So my view is that we can strike a balance. We can accept that there is pressure and capacity constraints brought about because of COVID, which means that we can't move this agenda forward as far and as fast as we want to under other circumstances. But I also think that if we want to keep our very diverse, multi-ethnic workforce on board, we have to be able to demonstrate progress on these issues. And I think that if we do that, we can really build their confidence and commitment and dedication during a period of pandemic. And if we don't, I think there is a risk that we will actually lose capacity rather than gain it. So I think that we are in a position to be able to create a win-win here. And I think my advice and encouragement to the Cabinet and to the Council would be to do that, recognise the balance, and I think we can achieve both things overall.
Thank you, Sean. Paul.
Thank you, Leader. I mean, I just want to re-emphasise, because Councillor Palmer obviously didn't hear me when I said it, I do think this is an important area. I really do. And especially our role as an employer. You know, it is a real problem that we have where as you get further and further into the organisation and higher into the organisation, it becomes more white and more male. There is a real problem with the senior leadership not representing the community they serve. And I think that needs to be dealt with. And I absolutely support the work to make sure, as long as it's based on merit, that we are appointing the best people, and those people should be representative of the community. So I really do think it's important, and I really do support that work. I do question, though, the timing of doing this during a global pandemic when there's so many other things going on. And that's only the point I'm making on that. I have two questions, though, if I may. I'm not sure if it's Chief Executive or the Leader or Barger who wants to pick them up. But firstly, I'd be grateful if they could outline the process that they went through to appoint the independent race advisor at a cost of £50,000. And I also think it would be helpful to set out exactly what they expect to be different after the council has spent £100,000 on this thing. Which of the measures that Councillor Henson talked about and the terrible list of statistics does he think will improve with this? Or if we're doing something internally, what measurable things do you think you can have that by the end of this process, and I accept it's not going to be within a few months, it's going to be longer than that. But I'd just like to see some clearer outcomes in terms of the numbers of people at different levels, or rather than just the process, actually what the deliverable outcomes are. Because I think some of the inequality within the workforce is something that has been talked about in this council for as long as I've been a councillor. I'm going back to at least 2001. And I don't think it's got any better over that time. So whilst it's good that there's a focus on it, I'd like to see measurable, deliverable outcomes that we can use to say that this money has been well spent. Thank you.
Would it be helpful if I responded in part to that?
Yeah, if you could do the process part.
Yeah. I mean, I think, Paul, they are very good questions, and I think that they're the right questions to ask. I mean, I think that the short answer is that those targets, measures and deliverables will be part of the detailed action plan that has developed over the next few months, which will be part of the work of the working party, which will be done on a cross-party basis, and I think that that's really, really important. I think from my point of view, it needs to include having clear targets about diversity in terms of senior management level. It needs to be about how we change the ethnic pay gap, and we can go through a whole series of targets that I think absolutely should be brought back to Cabinet to approve. Just in terms of the resources that are being expended here, I think that the key issue is that part of that will be about increasing the amount of training, development and capacity for staff from black backgrounds and across a wider range of protected characteristics in terms of their ability to essentially be successful when we do recruit. So a lot of this is about putting in place an organisational development and training programme for staff who are from Black and other ethnic backgrounds to progress within the organisation. So this is not spending money on policy. It is actually also about spending money on real change. But I completely agree. What the Cabinet needs to see and what the working group needs to develop is a series of clear targets and objectives. And I think one of the things that I would say as well is that I've worked in organisations, and I'm very pleased to say that Tracy Collins has worked in organisations where there has been both a clear set of programmes and practices that have been implemented that not only do the right thing but deliver results. So I do think that it's really important that we bring that back to Cabinet, and that there is a clear sense that it will ultimately, over a period of time, make a difference both to the views that our staff have about how diverse the organisation is and what they feel about whether we are an anti-racist council and whether there are issues of structural racism in the organisation, whether or not we change people's views about whether they have the opportunities to develop if they are from a Black or minority ethnic group, and similarly whether or not we change the makeup of the workforce. Because certainly one of my personal views is that I think, you know, one of the things I want to achieve while the Chief Executive of the Council is that when the Council gets to a point of choosing its new Chief Executive in the future, that actually there are both internal and external candidates from Black and minority ethnic backgrounds who are going to be able to potentially be appointable to that role. So I think that we do need a much more diverse workforce, and that's part of, I think, the test at a most senior level. I think in terms of Patrick Vernon, I think that what we did is that we sought, based upon our knowledge and experience across London, particularly as we were in the middle of a pandemic, of somebody who'd got a track record of doing this piece of work, and somebody who had actually been recommended by people who work with us. Tracy's come to us from Lambeth, probably the most diverse, one of the most diverse London boroughs. A borough that is actually the home of the Black community in London, and Patrick had been working there over the past period, and actually his track record and results in terms of doing things like changing the diversity of the senior leadership in that organisation had come across very strongly. So that's the basis on which we decided to go with Patrick, and my sense is that he comes in incredibly well qualified and well regarded.
Can I just come back very briefly?
Yeah.
I mean, first of all, I mean, I think actually we've got the right person. I don't dispute that. I'm just slightly nervous, given the sum of money involved, that there wasn't a slightly more transparent and robust process to get to what I think is the right outcome. Just on the targets, I mean, we've had these targets for forever. This is my concern and frustration at this. We've had targets about, you know, the percentage of top 5 earners from ethnic minorities and from women in the top 5%, and we just always had them flagged as red and never really had any action plan to deal with it. And I said it's both, the Black and ethnic minority thing is important, but also the women and the sex bias that we seem to have in our senior leadership is also, to me, important. You know, we need to have a robust system, and I think the problem is I think we do, but I don't know why we end up with the outcome we do, and that's why I'm getting really engaged in this working group to try and get my head around why we have what seems like a good process, but when you look at the outcome, it's not representative of the borough.
And I think, Paul, what I would say to you is that I think that if you look at the targets, they're good. I think if you look at the action plan, I'm not sure they have been. I think there's a whole range of reasons for that, particularly in the more recent past. And that's exactly what I'm saying, is that I personally think, based upon my experience, and Tracy personally thinks based on her experience, that there are a series of things that the council could do and will do that we have been doing less of in the recent past. And I think that whilst you can never guarantee anything, that if we do those things and we construct the programme in that way, we have much more confidence about being able to do that. I mean, I'll just give you one sort of slightly anecdotal example. I'm absolutely certain that actually the council has fair and robust processes when it recruits senior management, and the people that you as members interview and choose from when they're placed in front of you, you do in an absolutely fair and objective way. I genuinely think that is absolutely the case. What we ought to be saying to our recruitment consultants is, if you don't come up with a diverse shortlist, we won't be, you know, we won't be interviewing the candidates. Because we all, yeah.
Actually, can I just point out we've got five more reports to get through, and we've only got 10 minutes left.
I promise
So,
the last thing to say,
brief comments only, please.
Either on this report or indeed any future reports, I think I'm kind of done for the evening. But I just want to say, I forget the point I was going to make now, actually. But it was around it was around the process. It's not just that we need to have people from different backgrounds who are being interviewed. They need to be appointable people from these backgrounds. You know, my worry in some of this is you end up having someone there in order to tick a box, but they're never going to be appointable. And that's bad for them as an individual. It's bad for the organisation, and it puts everything back. And so it's when you go to headhunters or recruitment agencies, making sure they're actually getting appointable people at that level, not just a numbers game, because it has to be ultimately based on merit.
I think, Paul, you and I are on the same page here. I think the point is this is the sorts of issues we need to work through in detail through the working group. And I think that if we do that, I think that we will be able to hopefully be able to sign up collectively as a cabinet and as a senior management team to a clear strategy around this. And I think that is the purpose of the working group. So I'm encouraged by the debate and discussion.
Thank you.
And Vaj, you had a quick comment to make.
Yes, sorry, Graham, just to say that I agree with everything that Sean has said, but having conversations with Tracy, it is about changing how we, the policies, but also the training process, and also how we as a council attract the right caliber of people to apply for those jobs. And that is kind of what you're saying, Paul. So therefore, if we can change those dynamics, that is what we're working towards. So that will help us to get the percentages that we need to change the workforce and to encourage the staff that we already have who are then able to move forwards up the ladder as well. And that is what we are trying to do. And Tracy has experience of that. So that is what we are working towards. Thank you.
Yes, in the budget this year, there was an increase in funding to bring HR back in-house. Actually, we done it last year, where Tracy's developing the organisational development structures to train people. But when you ask what is the outcome that we really like to see, I think that is watching the webinars, they spell it out exactly what we would like to see afterwards. Some of the points that Kim made about being the chief executive and how Patrick Vernon was talking about some of the work he's done in the past, it sets out a place where we'd like to be. It's quite clear. The recommendations are on page 74. Are they agreed? They are.
Agreed.
We now move on to item 11, which is joining. Actually, it's 20:55. I didn't realise what the time was. Someone's just prompted me. So we have an extended agenda with items on the agenda tonight. So could we extend the agenda to cover these 5 items, please?
Yes.
Agreed. Thank you. Right, so we move on to item 11, which is joining Capital Letters London Limited, which is Phil. And I think Nick's here as well, I think.
No, Nick is not here. He's given his apologies.
Okay.
Thank you very much, Chairman. Chair. Yeah, it was back in 2018 that the London Housing Directors and London Councils worked on a model which would give better outcomes for homelessness and those at risk from councils and homelessness. The result of which was the establishment of Capital Letters. And this report seeks to outline and recommends that London Borough should join capital letter as part of the third wave of applications, and also to fund 2 members of staff to be directly recruited by capital letters. Thank you.
Thank you, Phil. Short and straight to the point. Is there any questions? We have had quite a wide-ranging briefing on this item. Is there any questions that need to be made tonight? No, there's no hands up. So can we move to the recommendations that are on page 94 and 95 and agree the recommendations, please?
Agreed.
Agreed.
And we now move on to item 12, which is Harrow Strategic Development Partnership appointment of directors. This is part of setting up, as part of the contract with our preferred bidder, which is being signed next year. We're setting up a shadow board, and this is setting out the recruitment of the independent person, and then at full council we decide who the 2 councillors will be on the board. It's quite straightforward. It's just sort of setting out that we go to recruitment through Chief Officer Employment Panel, taking on board the points that Paul made earlier on about making sure that we have a diverse representation on the board from Harrow Council. I can't see any hands. So Paul.
I mean, just to quickly say, obviously I don't agree with this process, but I do agree with the way we're selecting the independent director. I think the Chief Officers Panel is the right way to do it, and I welcome that cross-party engagement in that. Thank you.
Excellent. Yes, the dates are going to be put in the diary, and we'll look at the most suitable dates. The advert is out already. So the recommendations are on page 272. Are they agreed?
Agreed.
Agreed.
We now move on to a very important report, which is the Children and Young People Strategic Commissioning, the Emotional Wellbeing Service and Information Advice and Guidance Service. Christy.
Hello, Graham. I'll do my best to, I've been sitting here sort of chopping out sentences so that people will not be here till the early hours of the morning. So I am bringing this report to request that Cabinet delegates authority, as outlined at the beginning of the report, to allow the local authority to ensure continued delivery of essential beneficial services for children and young people in Harrow, and that Cabinet will support option 2 as outlined at the beginning of the report. There are 2 parts to this request, which lengthens what I have to say a little bit. First, we wish to issue a direct award of contract to Prospect, who are the present provider for Harrow's careers, advice, support and guidance service for young people. The current contract for this provider is to expire in March 21. The contract is worth £400,000 a year, and our request is for a direct award for 18 months, so that's 600,000. Because of the pandemic, as you will understand, this is a difficult time to go out to tender and to ensure that we maintain a good provision of service. The second part of this request is for Cabinet to approve the payment by the local authority to the CCG, with whom we jointly commission the emotional wellbeing service for children and young people, which is provided by Barnardo's and is known as Harrow Horizons, the title being chosen by children who are part of the decisions for setting up the way this group runs. The work of both services is valued by the children and young people who use them, and both services offer the local authority good value for money. Both services have successfully adapted their ways of supporting children and young people through the pandemic, and in both cases, children and young people have responded very positively to this. The performance of both Prospect and Harrow Horizons is carefully evaluated and measured, and this will of course continue. Their outcome measures are good. You'll know the pandemic has been very difficult for children and young people. They've been experiencing a great deal of anxiety and loss, having to adjust to so many restrictions, and they're uncertain about their future. We've always had very low levels of NEETs in Harrow, but it is on the rise. It's understandable. They don't know where they're going to go. They don't know what to turn to. And that's why these services are so valuable. Referrals to both services have risen, and that rise is expected to continue. We've worked with both services to support and encourage them to expand and adapt their services during the pandemic. And we want to continue with these provisions so that we can properly evaluate as far as we go forward. We've actually been, the CCG through CNWL and the local authority have been successful in bids that we've put forward to actually extend the services we offer in schools. One of them is for a level of mental health support, which is from CNWL, and the other one is for a small social work team, which will be embedded in schools. And we hope, therefore, to extend this service across these two providers with this extra, more specialist support. I just think our children and young people deserve the best we can afford, the best we can provide, and these services provide good support. And I'm therefore requesting your support to allow this to continue. Thank you.
Thank you very much, Christine. Paul.
Just very quickly, I broadly welcome this. I mean, I know Councillor Robson talked about it, but it would be helpful to see in the report a bit more of those performance and outcome statistics. In performance section just really talks in the Careers Advisory Service about the NEET number. Obviously that's affected by a large number of things, of which the Careers Advisory and Information Service is part of, and it'll just be helpful, I think, to have a more discrete measure about the value that they're adding. I just think, you know, as you rightly say, at this time, both children's mental health and also, you know, the future career prospects for children is really going to be difficult, and I think it's really important that we make sure that that service is firing all cylinders. It's really, really vital going forward. I just would have liked to see a little bit more, and I did ask officers in the briefing I had and haven't yet received it, just a bit more about how we measure the value that these things add rather than just an overall borough-wide statistic.
Thank you for that, Paul. Yes, I do know that you were given a very thorough briefing, actually. But where we are is that actually, I suppose, as an old-fashioned clinician, there are ways of doing this. NEETs is only one bit of it, as you will understand. There are clinical ways of measuring performance and looking at outcome measures. And if you are still requiring more information on that, I will speak to Paul Hewitt about it. But basically, this is much better than it was a few years ago, Paul, as you will know, when we just handed out contracts willy-nilly and we didn't know how to measure outcomes at all. Well, we do now. Thank you.
Thank you very much, and let's also thank you to the team for the briefings that have taken place. There have been quite a few, and they fitted around some people's availabilities and diaries. One of the things that we haven't been able to do during COVID is the performance reports, but I'm sure that'll be picked. Some of this information will be picked up through those later when we rebuild it back. The recommendations are on page 282, and as Christine has just said, it is the option that we extend issue a direct award to the incumbent provider for the Harrow Information and Guidance Service. We're also delegating authority, and we're also approving the financial contribution made to the CCG. Are they all agreed?
Agreed.
Thank you. We now move on to. You're welcome. We now move on to the penultimate report, which is People Services Direct Strategic Commissioning Extra Care Strategy Update. Simon.
Thank you, Leader. Yeah, so this is the next stage of implementing our extra care strategy, which we agreed back, I think it was in November 2018. And as well as reporting on the current situation, what I'm asking Cabinet here tonight is to agree delegated authority to procure the extra care wellbeing services, and by that I mean the care portion of our extra care establishments, plus then the authority to go out to award contracts following that exercise. The current situation remains at the very least as it was when we did the review. That is an absolute need for this extra care provision to allow residents to remain and live in the community with just a little bit of extra help. And COVID and its aftermath, of course, is likely to add to this demand curve, no doubt about that. So we're looking at procuring services for the existing Ewart House provision, where the care contract is coming to an end, and the brand new Windridge Court, which I and perhaps other people perhaps know as was Watkins House, where the housing provider for both is going to be Harrow Churches Housing Association. And this will give us a total of just over 100 homes in the extra care provision. And then we'll have more schemes in the pipeline for the next 2 to 3 years, perhaps 4 years. Worston Home in Stanmore, near Stanmore Old Church, again Harrow Churches Housing Association, and a provision on Harrow View East on the old Kodak site, which will add another 120 homes or so. I'm glad to say all 3 bills will meet the London Plan requirement of at least 35% reduction in carbon emissions on site and help support our commitment to a cleaner environment. And we'll be looking to include a commitment from potential suppliers to include paying London living wage, which is another of our key ambitions. But the main thing is for us to provide enough homes for our ageing population with their ever-growing complex health needs with the right level of support to allow them to live at home and to delay or to stop the need for them to move into residential or care home environments. It's better for them, it's better for their families, and in the long term, of course, it's better for the council's financial position. So I ask Cabinet to approve these recommendations. Thank you, Leader.
Thank you, Simon.
I'm dinging.
Just watching questions popping up and hands popping up. Phil.
Yeah, I just wanted to make a comment on the report and how it is important that we do address the extra care housing for our elderly population of Harrow, which we've seen grown over a number of years, and the lack of that type of housing being available. So I applaud the report to Cabinet.
Thank you, Phil. Was there any other comments? I think Phil's just made a point, and I think Simon was going through is about our ageing population in Harrow, and it is one of our driving forces of expenditure. So to maintain it at a lower level, now through these sort of projects allows it to be sort of not controlled, but have sort of some reductions and mitigation in place. The recommendations are on page 296. Are they agreed?
Agreed.
Yeah.
Yes, agreed.
We now end up on People's Services Strategic Commissioning, Adult Mental Health Review and Next Steps. Simon.
Right, thank you, Leader. Yeah, this review covers the mental health provision provided or commissioned by ourselves that's available to people who require support in their recovery after leaving hospital to support and sustain their well-being and independence in the community. We've had detailed briefings on this. We'll be able to have more detailed discussion, I believe, at the Health and Social Care Scrutiny Commission next week, and it will no doubt go to Health and Wellbeing Board for this discussion amongst our health partners on this. But the review really was aimed at examining the existing system and was it delivering the expected outcomes and pathways that we wanted. Was it leading to people's recovery? Was it leading to their independence, return to work or return to training? Was it reducing repeat hospital admissions? Was it all joined up? Was it centred on the person? In other words, was it working? Now, the review was informed and by a whole range of service users. There were forum groups. It was also involving carers and their families. We wanted to know what was working, what wasn't working. It started at the beginning of the year. There were due to be 4 focus groups led by HUG, Harrow User Group, where I live, my part in my local community, advice and information, and then COVID stepped in So we still have got to look at the access to learning and employment. But this report, this process produced some recommendations, which you see towards the end of the report. And I think the conclusion really was that although parts of the service were working well, they weren't working together. They were working more in a silo or in a bubble, if you like. And there wasn't a clear pathway completely through the system leading to eventual recovery. So what can we do better? Well, the recommendations you can see in the report, there is a need for a whole system approach to commissioning of mental health. We need to involve and recognise the contributions of the voluntary sector. We need to offer greater support to carers. So what are we going to do? Well, we're going to, I'm sorry about this dinging, it's driving me bonkers. What we want to do is establish a co-production group with membership from all of the stakeholders I've mentioned, to go through a redesign exercise to have a community support service network as part of a whole system approach with resilience, and to develop and expand the existing out of hospital recovery pathway, providing a holistic response that enables people to safely transition from being inpatients to being members of the community in their own homes in Harrow. And that is the basis. A very detailed report. I'd like to thank all those involved in its production, from the council and from the voluntary sector, from users, from carers, etc. And I'd like to go forward and recommend Cabinet the recommendations that we go forward with this and start the real work now, which is to produce a really good working system. Thank you.
Thank you, Simon. Christine, you have your hand up.
I do, just very briefly to join you, Simon. I think in what you're saying is to welcome this. I mean, this is really what we've been needing, and I do hope it all goes well. And it's so well reported. It's an excellent report. Thank you.
Thank you. Just so people are aware, it is in my register of interests that my wife does work for Rethink Mental Health, which is mentioned within the report, but it's a non-pecuniary interest. But I also pick up on Simon's point that through COVID as well, around one of the biggest rises we've seen is trying to access mental health services, and we've seen quite a high demand there. And having a clearer pathway through that will make it a lot easier for a larger number of people. So the report, I can sort of thank the people who put that report together, because it's taken a lot of not just energy and things like that, but it's also a lot of empathy has been involved to make sure that we have the right pathways in place and the right people in the right place at the right time approach. We've done it in other services across adult services, it's big and children's services, or the people's directorates of where we're having these joined up approach and integrated services. And I think this goes to help the resident more, you know, trying to navigate sometimes a complex system. So thank you very much. The recommendations are on page 308. As Simon says, this has to go into health scrutiny next week, and it's going to the Health and Wellbeing Board as well. So the recommendations are on page 308. Can we agree the recommendations?
Yes.
Agreed.
Yes.
Thank you. So we now move on to the final item of any other business. I've got 9 items of any other business. No, sorry. We haven't got any items of any other business. So I'd like to thank you all for your time. I know we've overrun, but we've had some very important issues on the agenda tonight, and it is right that we gave them the time to make the right decisions and listen to what people are saying. So thank you for your time tonight, and I will see you all soon. Thank you.
Thank you. Good night.
Thank you all.
Good night.